Have you recently had a child and now you're losing tons of hair and you're fatigued and it takes all you got to get through the day and take care of that baby? Well, then I believe there's a chance you may have what's called postpartum Hashimoto's. Hashimoto's is thyroid autoimmunity. When my wife had our third child, I was entering the shower one day and it looked like someone got scalped in there. And then I didn't really say anything because you know how ladies like to put their hair on the wall, so we just clean it up and let it go. But then over time it continued to happen, and I noticed a bald spot on her head one day, and I said, I'm going to look for thyroid autoimmunity in her. And it turns out that she was positive for it. And so she had developed postpartum Hashimoto's disease after the birth of our son. Research shows that up to 12% of births result or end with postpartum Hashimoto's. And the symptoms of Hashimoto's or thyroid autoimmunity is fatigue, brain fog, hair loss, unhealthy hair, skin, and nails. So all of these things fit, and these are all complaints that women enter their doctor's office with very often postpartum, and they're brushed off as, oh, of course you're tired and losing hair, you just had a baby. Well, I believe that 12% number would be much higher if we actually tested each of these women to rule in or rule it out. So anecdotally in my practice, I look for this whenever I see it in a woman who's just had a baby, especially if that baby's a boy. I can't tell you with any scientific reason why it seems to occur more in boy births than in girl births, but that's what I've seen anecdotally. So if you're a woman with these complaints, and especially if your birth was a male birth, then I recommend you ask your GP to test for thyroid antibodies, or your functional medicine practitioner to test for thyroid antibodies to rule in or rule this out.